This segment of Westlake Live is sponsored by the Blue Buffalo Company Natural Veterinary Diet. SLA Video Productions presents from the beautiful Westlake Community Services Center in Westlake, Ohio. It's Westlake Live!
Welcome back. Now we're going to talk more about Alice's specialty, skin disorders and allergies, owner's observations, maybe warning signs of not only those conditions, but something that would just let you think that there's something not right with my pet today. What's going on?
Let's start with that. Pets are a very regular species, okay? They're kind of like us. They like their schedule. Whenever you see your pet divert from their schedule, and I'll give you an example. I adopted an older golden, and we walked every day at Hinkley Lake. Well, all of a sudden, she just didn't want to walk, and I thought, well, does she have a muscle problem, bone problem? No, all that was fine. That was the initial sign she had a brain tumor. Oh. But see, that was something out of the norm. So they're creatures of habit. My advice to you, just get to know your pet, and when you start to see a little subtle sign of change, that's when you need to call the vet. And if the vet doesn't want to listen to you saying, oh, that's just normal. No, it's not normal for my pet. They don't normally do this, okay? Mm-hmm. So that is really what I could tell you. I'm a big believer in preventative health, and whenever I see something that, oh, now why is he going over there? He never used to do that. That needs to be checked out. A little bit about allergy and dermatology. The reason that is linked together in the specialty in veterinary medicine is because the signs of allergy in pets are not upper respiratory. Like for us, they are skin signs. They lick their feet, they rub their face, they rub their butt, anywhere that they're in contact with that allergen. So when they're walking or laying with their tummy on the grass or sitting on the grass, that allergen is absorbed across the skin and gets into their immune system, and then the immunity tries to fight it off. So that's why they'll start to itch and scratch and lick their feet. Cats do their own thing. Cats with allergies can present anyway. They can get little, what we call miliary dermatitis, little lesions under the skin, little crusts. They can rub their face. They can lick their fur off because they itch, and they can't tell us why. So the reason allergy and derm are connected is because the signs of allergy are dermatological. I love my specialty because it's one specialty that I still need to see that pet. You know, with the advent of telemedicine, sure, you know, if you have a bad liver, they look at your liver values. They don't look at your liver. But with derm, I need to see that pet, smell that pet, touch those lesions, and perform little biopsies or whatever else that I can do. But I love that about dermatology because I still need to see the pet after all of these different specialties. It's still one that we need to do a good physical exam.
Now, I know you're a healthy eater yourself, so tell us about what you feel about nutrition for your pets.
Okay, well, this is tough because there's a lot of misinformation out there. Every company's fabulous according to them. Mm-hmm. So my tips for you, first of all, there's an organization called AAFCO, American Association of Feed Officials, and they set the regulations for pet food. They don't enforce them, but they say, okay, if you're going to manufacture a dog food, it has to have this much protein, this minimum, this much copper, this much mineral. Okay, so that's set. So every pet food company has to meet those AAFCO regulations. Then there's something called WSAVA, which is the World Small Animal Veterinary Association. You can go on their website, and they give you tips for what kind of pet food companies are good, quote unquote. And some of their tips are, okay, do they have quality control? Well, what pet food company wouldn't have quality control? But some don't. Do they do research? And is it peer-reviewed research? Do they check for salmonella and E. coli and listeria and all those other horrible bacteria? Do you have a third party check your food periodically for all of those bacteria? And is that food nutritionally complete? Has it undergone a feeding trial, which is not much? It's only 26 weeks and 8 dogs, which isn't much, but it's all we've got. So if that food company qualifies for all of those, including having a board-certified nutritionist or a PhD nutritionist on staff, then I'd say that's a pretty good company. And literally, the bigger companies have that. Hills, Royal Canine, Blue Buffalo, Rain is another company, Purina. They all qualify for all of those characteristics that I mentioned. So as far as what to feed your pet, I would stick with one of the top companies because they're actually monitored more than the ones that fly under the radar. And to be honest with you, when a company hasn't had a recall, you almost should be suspicious of that because why? Do you have quality control? At any of these pet food companies, you should be able to call and ask for that data. And if they don't give you that information, can't or won't, need to switch to somewhere else.
Wow.
And if you want mine, I'll tell you what mine need. Mine need Purina and Blue Buffalo. I have two different, an old dog and a young dog.
Okay, and then I think most people here would know this, but you'd be surprised how many people don't. You should never give your dog chocolate, correct?
Right, there's a lot of things. Chocolate, grapes and raisins. We now know that genetically some dogs will go into kidney failure from grapes and or raisins.
Wow.
Onion and garlic can break down red blood cells. Too much of that isn't good. Macadamia nuts. Xylitol, we know the artificial sweetener, which is in gum and some muffins and in some peanut butters. So, the other thing I have to tell you about snacks. I can't tell you the last time I bought a treat for my dogs. I use their food as treats, okay? Because some treats have more calories than a Snickers bar.
Wow.
So if you've got a dog that can't lose weight, get rid of those treats, okay?
Okay.
Use fruits and veggies, except no grapes or raisins. Or use their regular pet food.
Well, getting on to the nutrition, let's go further. How do you feel about supplements for pets?
Well, if they're getting a good, well-balanced diet, like a good fatty acid omega-3 amount in that food, which, by the way, can help with joint disease, heart disease, kidney disease, depression, that's great. They don't need a supplement. And as a matter of fact, there was a study done if you want to give your dog fish oil, the majority of diets, the 4 companies I mentioned, actually have more fish oil in them than you can give in a capsule. And I always wondered, why do my patients that are on a high fatty acid, like fish-based diet, do so much better than the ones that I put on fish oil capsules? And that study proved it. Because I believe that 1 cup of the one food that's fish-based had more than 10 capsules of the omega-3s that I was having people give. So technically, if they're on a well-balanced food, and by the way, if you have a puppy, make sure on that bag it says approved for growth. You don't want to give an adult formula to a puppy because it doesn't have the right protein and calcium amounts in it.
Okay, and then lastly, within this category, you made the startling revelation the other day that sometimes people try to give human medications to animals. So talk about that.
I actually lecture in an elective at the Pharmacy College in Northeast Ohio College of Medicine to the pharmacy students on the differences between human drugs and their use in dogs and cats. Let's start with acetaminophen. Never should be given to a cat, ever. 1 tablet will kill a cat. Ibuprofen, Motrin, never to a dog or cat. Dogs have their own non-steroidals. They have Rimadyl, they have Deramax, they have Galliprant. My neighbor is an MD and his wife is a nurse, and they called me one day. They have 2 black labs. The doctor's giving their dog Motrin because it's limping. I said, stop it right now. Because that dog could go into kidney failure. Well, thankfully, he'd only done it for a day. Aspirin, for example, a cat takes 5 days to get aspirin out of their system. Dogs is about the same as you and me. So when it comes to dogs and cats, remember this, dogs are not small humans, cats are not small dogs. We all metabolize things differently. And, like the educated MD neighbor of mine, well, I'm 150 pounds, so I take this much Motrin. A dog's 80 pounds, I'll just give him half of that. Absolutely not. That Motrin could have set that dog into kidney failure. So there's a lot of differences. Always ask your veterinarian because that's a very important difference there. Those are the 2 I can think of. The number 1 poisoning of 2020 for dogs and cats was ibuprofen.
Wow.
And actually, antidepressants was high up on there because everyone in this world, when I graduated pharmacy school, everybody was on Tagamet. Now everyone's on an antidepressant. So that's far, we might not have come since 1977, I don't know. But antidepressants, for some reason, cats like the taste of those. And if I may, one more thing, topical creams, 1 lick of that can be toxic to a cat. So yeah, people think topical creams, oh, it's not oral. How could it be It's harmful. And you come home and there's the empty topical and the dog ingested the whole thing. So minoxidil, thank you, Rogaine, yeah, very toxic to dogs and cats. As opposed to asking the pharmacist, hey, what dose of Benadryl can I give my dog? You know, you just got a bee sting. Make sure you call the vet, okay? Or another good one is Pet Poison Hotline. It's much cheaper than poison control, and it's all geared to pets.
Okay, well, that was a lot of information, but very helpful on this particular segment of our discussion with Dr. Jeromin. Thank you for watching Westlake Live Outside. Please subscribe to our YouTube channel and also support our sponsors. Thank you.
Vaccinations are absolutely necessary in dogs. That's how we've gotten rid of distemper. That's how we've gotten rid of rabies. But having said that, your dog actually needs a physical examination when it's getting that vaccination, okay? You can buy those little stickers for your door that says, attention fire people, I've got how many dogs, how many cats in here. And those are great as long as you keep them up to date, okay? If, God forbid, you lose a dog, change that 2 to 1, because you don't want to lose a human life going in there for that second dog that doesn't exist. Those 2 areas, smoking and pesticide, herbicide, have been tied to cancer scientifically. There's no question about it.
This segment has been brought to you by the Blue Buffalo Company Natural Veterinary Diet. Love them like family, feed them like family. And we want to hear from you. Contact us online or through social media with ideas and suggestions for future content. Also, you can help us enlighten and inspire others by sponsoring one of our video podcasts or any of our content.